Medication side effects you've probably never heard about, part 19. The use of general anesthesia in surgery and procedures like colonoscopy have four major goals: to make the person unconscious, to make sure that they don't feel any pain, to make sure that they can't move, and to make sure that they don't remember the procedure. General anesthesia requires a combination of several drugs in order to meet those four major goals. The most common side effects that people complain about after anesthesia include nausea, vomiting, dry mouth, a sore, scratchy throat, or feeling hoarse, having sort of a hangover feeling or being really tired afterwards, some confusion or short-term memory loss. But another common side effect that we don't talk about very much is urinary retention. Post-operative urinary retention is a relatively common side effect of anesthesia that can be a medical emergency. This is sort of an oversimplification, but imagine if the rest of the body woke up from anesthesia, but the bladder didn't. And your bladder's filling up with urine and you don't feel it and you can't urinate. Or maybe you can feel it, but your bladder is still paralyzed to the point that you can't really empty it. So the result of that is actually stretching of the bladder like a balloon. The shape is fine before you blow it up too much. So it doesn't actually go back to the same shape it was. If the bladder becomes too full, it actually stretches it out to the point that it never goes back to the shape it was before, which can require surgery for correction. There have even been cases of people whose bladder actually perforated because of this problem. People who are at the highest risk are men and people who have a history of BPH, people with diabetes, and people with a history of urinary tract infections, as well as smokers. If you ever have any kind of anesthesia, make sure that you go to the bathroom and empty your bladder before you leave the surgery center. If you can't go, they can catheterize you, and that will help prevent any long-term bladder damage. Follow for more.